Hello everybody, my name is Christian Brindle. I hope this video finds you doing well today. And I wanted to come and talk to you about something that I get asked about a lot. Now who am I? I'm a Medicare expert. I work with people just like you who may or may not know their options about Medicare when they're turning 65, whether they're over the age of 65 and they're retiring later, whether they're on a retiree plan and they want to see if they can do something better, or whether they're already on a Medicare plan and they don't think it's the best fit for them. I live in Sandy, Utah. That's where this video is coming from. And today we're going to talk about Medigaps. You hear about them all the time. Some people call them Medigaps, some people call them Medicare supplements, and you hear all these different terms being tossed around. Part A, Part B, Part D, Part C, Part Z is going to be next before we know it. I'm going to be talking to you today just about the Medicare supplement side of things, okay? So, we want to talk about today Medicare supplements, but a certain type of Medicare supplement that, in my opinion, currently is the strongest Medicare supplement in the market today, and it's something you need to be considering, and it's something you need to be looking at strongly if you're in the market for a Medigap, okay? Follow me so far? So, we're going to be talking about Medicare supplements first of all. What is it? How does it work? Well, can you see me okay in the lens? Okay. When you first get onto Medicare, folks, you have two parts of Medicare that come from the government, right? And most of you probably already know this, but I'm going to go over it anyway, just for the people at home that don't. Excuse my chicken scratch of handwriting. I think I can handle the A, B, C's, right? Just writing those out. So we got Medicare Part A and Medicare Part B. Can you see that okay? Okay, good. So you have A and B through the government, right? Now, this video is being shot in 2018. If you end up watching this down the road in years later, this information could be a little different as far as the numbers I'm about to throw out for you. So keep that in mind. Make sure you have up-to-date information. Now, Medicare Part A has no premium attached to it. I'll just put a 0 here. No premium attached to it, right? As long as you've worked in the United States for at least 10 years of your life. Most people have. That means you have enough working credits. That means you've paid enough into FICA taxes throughout your life, which is Social Security, Medicare taxes, things along that nature that pays for your Medicare Part A. Now, Medicare Part B is a little different. It has a premium attached to it. Now, right now, as I talk to you, as I shoot this video, that premium is $134 nationally, okay? And that's basically the same for everybody. Now, if you got on Medicare later, let's say you got on it 5 years ago, there's a chance that you could still be paying $104.90 because that's what it was before. But eventually, everybody's going to be here. However, if you're in a high tax bracket, let's say you're in a 6-income tax bracket, and as far as your income level goes, they can charge you more for that. But I'm just talking about 95% of the people that are going to be watching this that are below that tax bracket. If you want to know more about that, I'll make a video in the future about which tax bracket can, do different levels for Medicare Part B premium and how much you pay for each tax bracket. We'll talk about that in later videos, but right now we're talking about Medigaps. So you're at $134 for Medicare Part B, right? Now, A and B through the government, what do? Well, Medicare Part A gives you, I'm going to do my best to write on this. Hospital coverage, hospitalization. Now, there's other things that Medicare Part A covers, but that's what it's mostly known for. Now, when I say the hospital, I mean literally the hospital room, the hospital bed, the walls, the ceiling, the floor. It's the physical hospital, but it doesn't cover anything in the hospital. See how that works? I need you to grasp this. Now, Medicare Part B gives you medical expenses, right? So the way I've always liked to explain it and think of it, can you see this okay? Okay, the way I've always liked to explain it and think of it is Medicare Part A is the hospital, Part B is everything else. Now, if A covers the hospital room, the bed, and the walls in the physical hospital, that means B will cover the doctor in the hospital, the IV, the anesthesiologist, the MRI, and Part B also is going to cover you in outpatient procedures. Outpatient meaning same day. You walk in, you walk out. You don't spend any time in the hospital. You don't spend any nights of any kind. So A and B together give you medical coverage. Together, right? Now, on their own, the coverage kind of leaves something to be desired, right? So Medicare Part A and B by themselves, basically they have deductibles and co-pays and things like that, but that's not the thing that mostly concerns people, right? Because most insurances have those. What does concern people is, in most cases, it's Medicare Part B that does this, pays about, after deductibles are met, they pay about 20% of medical bills. Well, 20%, 80%, you pay 20. Sorry, it's been a long day already, and we're just getting started and it's already been a long day. So they pay about 80% of your medical bills, leaving you with 20%, okay? So lots of insurances have safety blankets with this kind of stuff. You know, when you have an 80-20 split like that, lots of insurances have where they have maximum amount of pockets to where you can't exceed a certain amount in a calendar year. It's like a safety blanket to protect you from ever paying too much. Sometimes it's $5,000, $6,000, $7,000, $8,000, sometimes it's $10,000. Medicare is one of the few insurances you're going to run into that does not give you that, okay? Basically, that 20% is unlimited. So if you have a $100,000 bill, hypothetically speaking, there's a good chance after deductibles and everything like that, of what you've met, you're going to walk away paying about $20,000, okay? And it's going to be in a situation, and this could be outpatient surgeries, doctor's office visits, things like that. So they came out with what's called, in 1966, they came out with the first Medicare supplements, but we're not going to talk about 1966 today. Later on, if you guys get a request enough for this, I'll do a history of a Medigap video for you. Okay? You think that'd be good? You do? Okay. So basically, when you have a Medicare supplement, also known as Medigap, what you'll find is most things in the Medicare world usually have two different names for the same thing. People always ask me why that is. My best answer is, and this is the best answer I've ever got from anybody, is because it's government-controlled insurance, and the government has to make everything as confusing as possible. They can't do anything easy or simply. They have to make it complicated as all heck. So Medigap, Medicare supplement, if you hear the two terms, they're the same thing. They're two names for the same thing, okay? But we're going to go with the term Medigap in this video today. So Medigaps are through private insurance companies, so companies you've heard of, and some companies you haven't heard of. There's a lot of companies usually in most states that do Medicare supplement plans. Think Mutual of Omaha, United Healthcare, Humana, Aetna, companies like that. The big fish, the ones you hear about, Cigna, Bankers Life, companies like that. And if you guys want me to do specific reviews on different insurance companies that do Medicare supplements, I am totally down. I will do that if I get enough requests for it. Medigap plans though. Basically, the way that these programs work is every single Medigap is designed by the government. So the plans themselves that are available are created by Medicare, the government. Medicare then names these plans after letters, right? So they're going to call them, so when you hear Plan F, Plan G, Plan N, not to be confused with Part A or Part B or anything like that, they're plan names. It's not a part of Medicare, it's a type of Medigap plan, right? So you have Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan N, Plan M, Plan L, Plan K. Those are basically most of the supplements that you're going to have available to you to pick from. And these plans are then given to private insurance companies to market. So the insurance company takes the plan as is. They take the coverage as is. So what that means is we're talking about G plan today, and we're going to get into that in a second, I promise. basically with a Plan G or any other Medicare supplement, it's going to be the exact same plan with every insurance company. So you can literally go out into the marketplace in most areas and look at 50 different Plan Gs, and they're all going to be the exact same coverage. There's no difference as far as the coverage goes. There are some that are double the price of others as well. The insurance companies, the one thing that they can control, well, two things. The first one is they control how much the premiums are going to be for this G. So you're going to, all 50 Gs that you can get in the marketplace through all these different insurance companies, they're all going to have their own monthly premium that the insurance company predicts. So people always ask me, why don't I just go with the lowest possible premium? Because if you go with the lowest monthly premium available, normally, not always, but normally in most areas, if you look at the lowest of the low, the lowest possible ones that are out there, you'll notice you don't recognize the names of the insurance companies, not familiar insurance companies, you know. It's kind of nobody companies. I'm not going to say any names because I can get in trouble, but companies that you haven't heard of, right? Typically, these are companies that come into the Medicare supplement marketplace who nobody knows, and the only way they can stand out is by throwing out the lowest price available, right? Now, most of you probably already know if you're watching this video that Medicare supplements raise their premiums every year as you get older. It's not a matter of if, it's a matter of how much, because they're all going to do it, all of them. If anyone told you otherwise, it's not true. All Medicare supplements go up in price each year. They have rate increases, and so if you were what these little tiny companies do is they'll throw out the lowest rate down here, right? Let's say the rest of the marketplace is up here, right? So the big fish are up here, the big insurance companies, the multi-billion-dollar insurance companies. Well, they're not charging higher prices because they're cheap or they're selfish or anything like that. Well, they may, or they are or aren't. That's a story for another video. But if they could be down here, they would. The reason they don't throw out these prices is because companies that have been doing Medicare supplements for a long time are experienced. They're not going to throw out prices that they cannot sustain. So usually what happens with these lower companies is they reel in some people each year when they first get involved in the Medicare marketplace. They realize that they start paying some claims of these people. They realize that they can't sustain making a profit with the prices that low, and the rates go boom through the roof. That's when you see the 20% rate increases a year, 30, sometimes even 40% rate increases a year. And that's what we want to avoid. You always want to be looking for a Medicare supplement that's a company that's going to probably keep you in the single digits as low as possible over the long period of time. Because when you pick up a Medicare supplement, you want to pick one up that's going to last you for a long period of time. Okay? Medigaps. So you have these plans, right? You have Plan A, Plan F, Plan G, Plan N. We're just talking about the G today. I might do a video later on where we talk more in depth about different Medigaps in general, but for now I just want to talk about the G and why I think it's the best Medigap available in the marketplace today. The best overall, okay? So the way that a Medigap works is it fills in the gaps of Medicare. Whatever Medicare does not pay, the Medigap will pay, right? That includes deductibles, co-insurances, this 20% that's not paid up here, completely covered. Follow me? So, depending on the company and depending on the type of plan you go with, like if you went with a Plan F, right, you'd be walking away with no out-of-pocket as long as Medicare pays first. Because the Plan F's the only plan right now that covers everything. And I'm going to do another video about Plan F too. I have a lot of videos to do, let me just put it that way. We're going to try to do 2 a week. So if you guys want to see 2 a week, if you want to see 3 or more a week, if you think this is beneficial, you got to let me know and I will deliver it for you. But basically the way the G works is the G comes, they pay everything that Medicare does not pay. They're identical to the Plan F in every way, right? So Medicare pays everything but a deductible, the G pays it. And there's nothing that they don't pay except for one thing. They don't pay what's known as the Medicare Part B deductible. Okay. Now it's whatever it is. A couple years ago it was like $166. This year in 2018 it is $183. Okay? So the G does not pay that. You're responsible for that. That can be ran into when you go to the hospital, when you have an outpatient surgery. Sometimes if you have like lab work done at a doctor's office, you can run into it. It's a lot of different ways that can be triggered, but it's one time a year. It's annual. Once it's met, you have full coverage for the rest of the year. Now, a lot of people ask me, in comparison to the most popular Medicare supplement that has ever existed, this Plan F. Plan F doesn't have this, right? Plan F pays this $183 for you. That's the only difference between the two. And the Plan Fs have been around since 1992. They've been wildly popular because they're full coverage. People like the idea of full coverage. People understand it. It's easy to grasp. It's not confusing, so people pick it up. And they picked it up more than any other supplement ever. There's more people on Fs than any other Medicare supplement in the history of Medicare supplements. Also because there's more people on Medicare now than there ever have been, and people getting on at a higher rate more than ever. But the F pays the deductible and the G doesn't. So people ask me, why would I want a plan that has a deductible that I have to pay when I can get a plan with an F that doesn't? Well, in almost every area, right, of the country, in most markets, now this isn't the case in every market. I've worked in some markets that don't work this way, but very few and far between. Like here in Utah, the average price difference between an F and a G, in most cases, is usually at least $30 a month in premium. $30 difference a month in premium. The only difference in coverage is this guy, the $183 deductible. Okay. The G doesn't pay it, so you're responsible for it once a year. The F does. So let me put it in perspective. If you're going to the hospital every single month and you're spending like a week in there, I'm not trying to put you in the hospital. Not my intention here. I'm not trying to speak it into existence. But let's say, worst case scenario, you're going once a month, every single month, right? With the G, the first month you go, you pay that and they pay the rest of the bill. From that point going forward, you never pay that, right? With the F, you just would never pay that from the start. That's the only difference in the coverage. With the F and the Gs are so much dramatically cheaper, and the reason is because they're newer. They came out in 2010. There's not as many people on them. So the prices aren't as inflated, you know. People have been getting on Fs with insurance companies since 1992, right? And there's a lot of older people on Plan Fs, meaning that the claims are higher. You know, you typically, in most cases, the older you get, the more you end up using your insurance, the more health problems you usually have. So the Fs have become incredibly inflated in price. Now the Fs, you know, are going away in 2020. I'm going to do a video on that next week and explain how that works. But basically, the Gs are newer. There's less people on them. And they're just a different type of plan, you know, and so they are current, right? The F is an ancient plan in Medicare terms. So you have the $30 difference a month in premium alone. So if in a calendar year, if that was how much you're saving, sometimes you save even more. You save $360 a year in premium, enough to pay this deductible almost twice, which you only have to pay it once no matter what happens. So no matter what you do, whether you pay the deductible, whether you don't pay the deductible, you come out ahead on a G. See how that works? So the Gs automatically save you money no matter what your situation is. There is no situation where an F is a better investment in your money than a G. None. And there's very few times I can say that, because I always tell people, and you hear me say this a lot, Medicare plans, I always tell people on Medicare, you have to specifically pick something for your situation, and everybody's different, and every plan has different needs and preferences that they accommodate and other plans don't. They have different strengths and weaknesses. This situation, it's black and white, and you don't get that very often. The F in 2018, a Plan F is never a better situation than a G, ever, 150%, because you're always going to be saving this. The only situation that the F would not be, can you get me like a paper towel? The only situation that an F would not be a better, well, a G would not be better than an F, excuse me, would be if you save less premium than this deductible. And there's hardly any markets where that's the case. If that's the case, then the F still might be something worth thinking about. But even then, even if it's close, I still don't think that the F is a better option than the G. I mean, even if you're only saving $20 a month, because in some markets that's all the price difference is, you're still saving $240 a year in premium. Can you read that okay from the video? Okay. $240 a year in premium, more than the deductible, right? Very few markets. Now, even if it's close, even if it's like a $10 a month difference, like in very few markets, right? I'm going to talk to those people for a second. If they're very close in price, the G is still a better fit, and I'll tell you why. Okay? The G, hang on a second, I'm clearing the board. Okay. Every single Medigap plan, every single Medicare supplement through any insurance company in the United States of America has rate increases. I mean, I've only seen one company ever not go 1 year without a rate increase, and it was like 1 year out of 10. And that's out of more insurance companies than you can imagine, because we work with all of them, all the top ones in our market here in Utah. So basically, they all have rate increases, right? Different insurance companies have different rate increases. I've talked about before what you need to look for with an insurance company, a good, credible company, one that has a reasonable price starting out, but you don't always want to go necessarily with the lowest. You want to shop for a plan that's going to cover you good over a long period of time. And I'll talk about that more in another video. This video is just about the G. So a plan G, rate increase-wise, is currently the most friendly plan in the Medicare world with rate increases. It's not even close. I was the first person to catch on to this, right? Tell people what was happening 4 or 5 years ago with the Plan G when I run into them in the marketplace. People were every other agent was telling people to get Fs. What was I saying?
Get the G.
Do you remember why?
Because of the price difference and you're saving money over long term.
Mm-hmm. Exactly. I saw this before anybody did. Everybody else is catching up and they're copying me. Don't care what anybody says. I was doing this before anybody. I talked to someone who talked to 10 other agents, all told them to get an F. They come to me, I tell them to get a G, I break this down for them, and it's a no-brainer, right? Other agents started to catch up because they're getting punished. And their failure to be educated and up to date with this stuff was hurting them, and they finally figured this out. But let's compare the F and the G, because that's the plan that has been the most popular, and that's what I get the most questions about, right? So let's talk about rate increases from a national average standpoint for the past 5 years. From all the information I've been able to gather, so that to the best of my understanding, and even if these numbers aren't perfect, they're close, they're ballpark range. A Plan F has the highest rate increase average in. Basically, this is every Medicare supplement company that gives you an F averaged together, their rate increases for the past 5 years. You're looking at a 10 to 12% rate increase each and every year, ballpark. It could be a little more, it could be a little less, you never really know, but it's going to be ballpark that. And that's a huge number for an average. The reason that's going up so much is, like I said, the Plan Fs have been around since 1992, so like 26 years. And there's lots of people on them. The people that got on them originally are getting older, right? And they have all types of medical problems. The insurance companies that pay out tons of claims, and there's just millions and millions of people on these Plan Fs. The Gs are newer. There's not as many people on them. And over the next decade, they're going to be a better investment for your money. Because the Gs have the lowest rate increase average in the entire Medicare world right now. 3 to 5%. So not only do you save money starting out in 9 out of 10 markets here in the United States, over a 10-year period, this is going to kill you. These rates are going to shoot through the roof, and they're just going to completely wipe you out. Right? These are going to, not only are going to give you a lower price starting out, they're going to continue to stay lower over a long period of time. It's a no-brainer, folks. Pick up a Plan G. There's always a fantastic insurance company that you can work with in your market. If you're in Utah, if you're in Florida, those are the two markets that I work with predominantly, and you want to know more about this stuff, call my office. I'm going to put that number down in the description. And folks, if you want to know more about Medicare plans, if you want to know exactly what you have and you want to understand what your choices are and you want to really understand this stuff, it does not take years of study. It does not take, classes, and it doesn't take headaches and painfulness. This guy is a book that I published. I wrote about Medicare plans. There's a chapter on everything you need to know. Medicare Part A and B, the origins of Medicare, Medicare supplements, Medigaps, these things in more greater detail, Medicare Advantage plans, Medicare Part D plans. If you read this book cover to cover, it's a short, easy read. It's got big font, right? It's 50 pages. You should be able to read it in an hour or two. At the very least a day if you're a slow reader. Some people are. I myself am kind of a slow reader at times. Depends on what I'm reading. This guy, you will know more about what you're looking at and what you're choosing than 90% of the population that's on Medicare. You'll know more than you'll know more than a lot of agents will. You know what to look for. So I'm going to put a link in the description for my book, Medicare Guidance, picking the right plan for you. It's less than $5 right now on Amazon. For that, I'm practically giving it away. I mean, this book, for less than $5, maybe $10 with shipping, so let's say $10. For $10, this book will save you thousands of dollars in premiums and out of pocket just by knowing what to get and what not to get, and what mistakes not to make, and what things you do need to prioritize in your plan. When you put it that way, it's a no-brainer. This book can help you. Go to the link in the description, pick it up today. It's a no-brainer, guys. I am Christian Brindle. I am the Medicare expert, the senior advice on Medicare around, and I'm here to make this stuff easy for you. Buy Plan G. Thanks so much. I'll see you next week.
Hi! Thanks for watching. Please don't forget to hit that like button and subscribe to our channel for future videos.